Welcome back to MCQs Master 101, your home for professional exam-ready nursing content. In today's video, we're diving into one of the most important clinical judgment skills in nursing, prioritization and delegation using the ABCs, airway, breathing, circulation. These top 50 high-yield questions will help you master safe decision-making, improve your critical thinking, and boost your performance on NCLEX, nursing school exams, and clinical practice. Get your notebook ready. Let's begin.
1. A nurse enters a room and finds a patient with audible stridor. What is the priority action? A. Notify respiratory therapy. B. Provide oral fluids. C. Assess airway patency. D. Apply warm compress. Answer. C. Assess airway patency. 2. Which patient should the nurse see first? A. Post-op client reporting pain 7/10. B. Client with asthma who is wheezing and has O2 sat 88%. C. Client requesting assistance to the bathroom. D. Client needing discharge teaching. Answer. B. Asthmatic client with O2 sat 88%. 3. Which task is appropriate to delegate to a UAP? A. Assessing lung sounds. B. Administering oral medications. C. Ambulating a stable patient. D. Evaluating pain relief. Answer. C. Ambulating a stable patient. 4. A client is vomiting blood. What is the priority? A. Insert IV line. B. Check hemoglobin. C. Assess airway and breathing. D. Document the incident. Answer. C. Assess airway and breathing. 5. Which patient's condition reflects a circulation priority? A. Respiratory rate of 10. B. Active bleeding from the surgical site. C. Stridor on inspiration. D. Severe anxiety. Answer. B. Active bleeding.
6. The nurse should first see a client who A. Has crackles in lungs. B. Has sudden confusion. C. Has a BP of 148/90. D. Needs wound dressing. Answer. B. Sudden confusion indicates decreased perfusion or oxygenation. 7. Which can be delegated to an LPN? A. Initial teaching on insulin injection. B. IV push morphine. C. Monitoring a stable patient's wound. D. Completing a care plan. Answer. C. Monitoring a stable wound. 8. A patient with COPD has an O2 saturation of 82%. Priority action. A. Call the doctor. B. Raise the head of bed. C. Perform oral care. D. Ask the UAP to take vitals again. Answer. B. Improve breathing position. 9. Which client should be prioritized? A. Fever 38.5 degrees Celsius. B. Heart rate 120 after activity. C. New onset chest pain. D. Chronic back pain. Answer. C. Chest pain is life-threatening.
10. Which task can the nurse delegate to UAP during a mass casualty event? A. Measuring urine output. B. Assessing pain level. C. Starting an IV. D. Administering oxygen. Answer A. UAP can measure output. 11. Which patient should be seen first using ABCs? A. Client with nausea. B. Client with slurred speech. C. Client with abdominal pain. D. Client with RR of 32 and accessory muscle use. Answer D. Respiratory distress. 12. Appropriate to delegate to LPN. A. Blood transfusion. B. Hanging second IV antibiotic bag. C. Initial post-op assessment. D. Adjusting oxygen flow rate. Answer B. LPN can hang secondary IV bags if allowed by policy. 13. A patient is choking and unable to speak. Priority action. A. Encourage coughing. B. Heimlich maneuver. C. Call the provider. D. Give water. Answer B. Heimlich maneuver. 14. The UAP reports a patient with oxygen sat 84%. Nurse should A. Reassess patient immediately. B. Tell UAP to repeat measurement. C. Call the provider. D. Chart the findings. Answer A. Nurse must reassess. 15. Which client is the priority? A. Diabetic with BG 70 milligrams per deciliter. B. Post-op day 2 with fever. C. Client with new shortness of breath. D. Client who needs assistance eating. Answer C. Airway or breathing. 16. Which task can be delegated to UAP? A. Feeding a stroke patient with aspiration risk. B. Taking vitals on stable patient. C. Monitoring IV site for infiltration. D. Educating a patient. Answer B. Stable vitals. 17. A patient with pneumonia appears restless and confused. What is priority? A. Check temperature. B. Assess oxygenation. C. Offer fluids. D. Provide distraction. Answer B. Hypoxia sign. 18. Which client should be seen first? A. COPD patient with productive cough. B. Patient with facial burns. C. Hypertensive patient with headache. D. Patient needing IV antibiotics. Answer B. Facial burns risk airway obstruction. 19. A UAP reports a BP of 80/48. Nurse should A. Reassess BP immediately. B. Document it. C. Tell UAP to retake later. D. Call the provider first. Answer A. Nurse must validate. 20. Which client can be delegated to a UAP? A. Post-op day 1 ambulation. B. Unstable spine injury. C. New admission. D. Patient receiving blood transfusion. Answer A. stable ambulation.
21. Priority for a patient with increasing wheezing. A. Notify provider. B. Assess lung sounds. C. Give water. D. Start CPR. Answer is B. Assess before intervening. 22. Which client should be seen first? A. HR 118 after activity. B. O2 sat 89% on room air. C. BG 150 milligrams per deciliter. D. Nausea. Answer is B. Breathing issue. 23. Delegate to LPN. A. Titrating oxygen. B. IV push cardiac meds. C. Suctioning tracheostomy. D. Initial home health assessment. Answer is C. LPN can suction. 24. Sudden drop in urinary output is a problem with A. Airway. B. Breathing. C. Circulation. D. Safety. Answer is C. Circulation, perfusion. 25. Patient priority. A. Anxiety before surgery. B. Vomiting. C. RR 10 per minute. D. Needs Foley catheter removal. Answer is C. Respiratory depression.
26. Delegate to UAP. A. Range of motion exercises. B. Assess pain. C. Teach spirometer use. D. Change central line dressing. Answer A. ROM is allowed. 27. Most concerning finding. A. BP 146 over 84. B. Strinor. C. Mild crackles. D. Pulse 100 per minute. Answer B. Severe airway obstruction. 28. LPN can perform A. Initial assessment. B. Reinforcing teaching. C. Changing sterile PICC dressing. D. Developing care plan. Answer B. Reinforcement only. 29. Priority for anaphylaxis. A. Start IV fluids. B. Assess airway and breathing. C. Educate the patient. D. Draw labs. Answer B. Airway first. 30. Patient with chest tube shows no drainage and severe dyspnea. Priority. A. Call provider. B. Assess for kinks. C. Document. D. Administer PO analgesic. Answer B. Assess obstruction. 31. Delegate to UAP. A. Applying anti-embolism stockings. B. Evaluating tolerance to activity. C. Monitoring chest pain. D. Teaching walker use. Answer A. Routine task. 32. First client to see. A. Sudden slurred speech. B. Fever 38 degrees Celsius. C. Pain 8 over 10. D. Nausea after meals. Answer A. Possible stroke. 33. LPN delegation. A. Start blood transfusion. B. Administer oral meds. C. Perform initial triage. D. Change sterile abdominal dressing in unstable patient. Answer B. Oral meds allowed. 34. Priority finding. A. Diarrhea. B. S3 heart sound. C. Occasional wheeze. D. Hunger. Answer B. indicates heart failure. 35. UAP appropriate. A. Feeding patient with dysphagia. B. Collecting routine urine sample. C. Assessing lung sounds. D. Adjusting oxygen. Answer B. Routine collection.
36. Client to see first. A. COPD patient with cough. B. Patient with tracheostomy dislodged. C. Patient awaiting discharge. D. Patient requesting snacks. Answer B. Emergency airway. 37. Priority intervention. For tachycardia and hypotension. A. Assess circulation. B. Give water. C. Lower head of bed. D. Ask UAP to check again. Answer A. Evaluate perfusion first. 38. LPN can do A. Initial postpartum assessment. B. IV push narcotics. C. Reinforce breastfeeding teaching. D. Adjust ventilator settings. Answer C. Reinforcement only. 39. Client priority. A. Abdominal pain. B. O2 sat 86%. C. Mild fever. D. Sore throat. Answer B. Hypoxia. 40. Delegate to UAP. A. Transport stable patient to X-ray. B. Remove IV. C. Perform wound assessment. D. Teach medication adherence. Answer A. Transport stable patient. 41. Priority condition. A. Nosebleed. B. Drooling and difficulty swallowing. C. Headache 6 out of 10. D. Mild diarrhea. Answer B. Airway obstruction. 42. LPN delegation. A. Starting IV. B. Administering IM injection. C. Interpreting ECG. D. Triage. Answer B. IM injections allowed. 43. Priority patient. A. HR 110. B. BP 160/98. C. Chest pain radiating to left arm. D. Chronic foot ulcer. Answer C. Possible MI. 44. UAP task. A. Oral suctioning of unconscious patient. B. Checking rectal temperature. C. Monitoring for bleeding. D. Teaching diabetics. Answer B. UAP can do rectal temps per facility policy. 45. Priority finding. A. Restlessness post-op. B. Mild nausea. C. Constipation. D. Pain 5 out of 10. Answer A. Early hypoxia sign. 46. Which patient needs immediate care? A. Asthma patient with no improvement after albuterol. B. Post-op day 2 with fever 38.2 degrees Celsius. C. Chronic pain 8 out of 10. D. Dysuria x 2 days. Answer A. Severe respiratory risk. 47. Delegate to LPN. A.
tapering oxygen on unstable patient. B. Reinforcing inhaler education. C. Assessing a new admission. D. Administering IV push cardiac meds. Answer B. Reinforcement only. 48. Priority client. A. Syncopal episode with fall. B. Constipation for 3 days. C. Headache 4 out of 10. D. Post-op asking for pain meds. Answer A. Fall injury plus possible perfusion issue. 49. Appropriate UAP task. A. Suctioning tracheostomy. B. Measuring daily weights. C. Changing sterile dressing. D. Teaching walker use. Answer B. Routine task. 50. Priority patient. A. Dyspnea at rest. B. Chronic arthritis. C. Mild abdominal cramping. D. Requesting sleeping pill. Answer A. Airway breathing issue. Great job working through these ABC Prioritization and Delegation MCQs. If you found this helpful, don't forget to like, share, and subscribe to MCQs Master 101 for more high-quality nursing review content. Drop a comment below on which topic you want next. Thanks for watching. See you in the next video.